Welcome to today's lecture on Goodpasture syndrome. It's a rare autoimmune disorder causing kidney and lung damage. We'll cover topics like antibodies, complement system, genetics, therapies, immune cells, and prognosis. Let's begin. Goodpasture syndrome is caused by autoantibodies attacking the GBM, specifically the alpha-3 chain of type 4 collagen. Scientists have used techniques to identify the exact amino acid sequences recognized by these autoantibodies, giving insights into changes in the GBM. This knowledge has helped develop targeted therapies to prevent tissue damage. The complement system is important in the body's immune response and can be activated in Goodpasture syndrome. Activation happens when autoantibodies bind to the GBM, leading to inflammation and tissue damage. By understanding this process, we can develop targeted therapies to reduce inflammation in affected individuals. The pathogenesis of lung and kidney injury in Goodpasture syndrome involves complex interactions between immune cells, resident cells, and various signaling molecules. Different pro-inflammatory and pro-fibrotic mediators, such as cytokines, chemokines, growth factors, and matrix metalloproteinases, contribute to the recruitment and activation of immune cells, extracellular matrix remodeling, and tissue damage. By elucidating the key molecular players and pathways driving tissue injury, researchers can identify potential therapeutic targets and develop targeted interventions to halt or reverse the process and improve patient outcomes. Currently, the assessment of disease activity and treatment response in Goodpasture syndrome heavily relies on clinical evaluation, laboratory tests, and renal biopsies. However, the identification of reliable biomarkers capable of reflecting disease activity and predicting treatment response is of great clinical significance. Researchers are exploring the utility of various biomarkers, including but not limited to circulating cytokine and chemokine levels, autoantibody titers, and renal-specific markers, to provide insights into disease activity and response to therapy. The discovery of novel biomarkers could potentially enable more personalized treatment strategies and improve patient management. Genetic factors are known to influence an individual's susceptibility to autoimmune diseases, and Goodpasture syndrome is no exception. Studies have shown that certain human leukocyte antigen, HLA, alleles, especially HLA-DRB1x1501 and HLA-DQB1x602, are associated with an increased risk of developing the disease. Moreover, specific genetic variations have been linked to disease severity and prognosis. Understanding the role of genetic polymorphisms in Goodpasture syndrome can aid in risk stratification, early detection, and the development of personalized treatment approaches targeting specific immunogenetic profiles. In Goodpasture syndrome, immunosuppressive therapies like corticosteroids, cyclophosphamide, and rituximab play a crucial role. They inhibit immune cell activation and function, reducing damage. Studying their effects on T-cell subsets can improve personalized treatment approaches. Cellular immunity plays a critical role in the development and perpetuation of autoimmunity in Goodpasture syndrome. Macrophages and dendritic cells, as key antigen-presenting cells, are involved in the recognition and processing of the autoantigens derived from the GBM. The presentation of these autoantigens to T cells leads to their activation and subsequent production of autoantibodies. Elucidating the complex interactions between immune cells and the mechanisms of antigen presentation in Goodpasture syndrome is crucial for understanding the autoimmune mechanisms underlying the disease and exploring potential therapeutic targets. Gene therapy offers promising treatment and prevention possibilities for Goodpasture syndrome. Techniques like gene editing, gene silencing, and manipulating disease-causing genes show potential in altering disease outcomes and are currently being researched. In Goodpasture syndrome, activated neutrophils release harmful molecules that cause tissue damage and inflammation. Understanding how neutrophils are triggered and recruited may lead to new treatments that can reduce injury and improve outcomes for patients. Autoimmune diseases, including Goodpasture syndrome, arise due to the loss of self-tolerance, leading to an immune response directed against self-antigens. The breakdown of immune tolerance can occur through various mechanisms, such as molecular mimicry, defects in central and peripheral tolerance mechanisms, and dysregulation of immune checkpoints. Understanding the underlying mechanisms responsible for immune tolerance breakdown in Goodpasture syndrome is crucial for unraveling disease initiation and progression. This knowledge could potentially lead to the development of novel therapeutic approaches aimed at restoring immune tolerance and preventing or halting disease development. B cells play a crucial role in autoantibody production and the perpetuation of autoimmune responses. B cell depleting agents, such as rituximab, specifically target B cells and have shown promising results in the management of autoimmune diseases, including Goodpasture syndrome. By depleting B cells and reducing autoantibody production, rituximab can modulate the immune response and potentially mitigate tissue damage. This topic will delve into the mechanisms of action of B-cell depleting agents and evaluate their efficacy and safety in the context of Goodpasture syndrome, providing insights into their potential role as therapeutic agents. In addition to their impact on disease susceptibility, immunogenetic factors can also influence treatment response and long-term prognosis in Goodpasture syndrome. Genetic variations, such as HLA types and single nucleotide polymorphisms, can affect drug metabolism, immune response modulation, and the predisposition to adverse drug reactions. Understanding how these immunogenetic factors influence treatment response and prognosis can help in tailoring treatment strategies, selecting appropriate immunosuppressive agents, and optimizing personalized therapeutic regimens. Moreover, prognosticating disease outcomes based on immunogenetic profiles can aid in patient counseling and management decisions. In summary, Goodpasture syndrome is a complex autoimmune disease causing kidney and lung damage. The study of epitope mapping, complement activation, genetic factors, and therapies provide valuable insights for treatment and potential cures. Our multidisciplinary research aims to enhance patient outcomes. Thank you for watching.